the dais and everybody in the audience. It's a pleasure to be here, and thank you for providing me this opportunity. I stand here more as a human being rather than being called a medical director, because if I stand here as a human being, then I have immense opportunity to be and do what a good human being can do. For example, as a human being, I'm also the consumer. I'm not necessarily only the provider. But if I consider myself being the provider, I miss the opportunity to see the viewpoint of a consumer. So, with that, I would like to just share with you, my grandfather was a physician in Mysore many years ago, many decades ago. And as a physician, I have seen him treat patients, and his opinion was held in such high esteem without even being reimbursed for that opinion. And he had no qualms about not being reimbursed for that high opinion. It is what, like Dr. Velu mentioned, we have moved from that opinion-based medicine to evidence-based medicine, and now to personalized-based medicine. So what my grandfather did was provide an opinion as a human being, fundamentally having a skill component of health profession. Now the moment his humanity, or being a human, came down, that's when he was considered to be something different, rather a transactional effort happening, rather than health care being provided for. And my own journey over the last 20 years has seen that. When I joined post-graduation, and then when I came out of it, the commercialization of the healthcare had already started. And this happens when, as individuals, our human values start coming down and transactional effort starts going down. So I'm to talk on quality, and I see a huge link to that element. So if I have to define quality, it's going to be extremely challenging. I'll ask a simple question. How many of you believe that we can measure quality? Please raise your hands. How many of you believe you can measure quality? Because if I'm going to talk of quality, I just need to understand the pulse to understand if quality is measurable at all. If quality is not measurable, then how can we manage it? How can we control it? The simplest statement in any management discussion is, if you cannot measure something, you cannot manage it. As simple as that. So the question is, can you measure quality or not? If it's not measurable, believe me, you cannot manage it. You cannot control it. So while I was going through that journey of understanding what quality is, it struck to me while I was going through some of the journals, a simple definition of quality is absence of errors. If you go to any hotel and you know that the masala dosa is the best that is available, you go and sit there. The masala dosa comes after 2 hours. Do you think there is quality? No, the masala dosa itself is great, but there is no quality because you have spent 2 hours of your time sitting there waiting for the masala dosa. So the simplest definition of quality is absence of errors. And I would like to extrapolate this to the medical profession as well. And the question of quality comes when there are ancillary techniques that are being used for a particular diagnosis. For example, if a physician is interacting with the patient, his ability to be human as possible, gives a lot of comfort to the patient. Because then, even if there's an error on the physician's side, the patient looks at it from a very different viewpoint. But the moment the physician loses his humanity and is more transactional, even if he's doing a good job, he's never seen as a trustworthy person. So there is a lot of element of humanity in our own interaction, and collectively, I think all of us have a role to play. It is not just being one or the other. That's where we fail to see the entire being a human. We are doing so many things on a daily basis that we should be called human doings and not human beings, because we miss the point of being in the moment. So when the physician and the patient is interacting, there's a lot that the physician has to get done because it's evidence-based medicine. So to make it an evidence-based medicine, he has to ask for a certain investigation to demonstrate that the person has a disease or an absence of the disease. So for which he gets a test done. Now, I'm basically a laboratory person. I'm not a physician, I'm not a clinician in the true sense, but I'm a laboratory physician. So when a request for test gets done, the entire process of quality comes into play. The quality of the physician's care is slightly different than the quality of what evidence we are trying to seek. So the moment we get into the evidence of the investigative procedure, there are a whole lot of variables. And we are talking of the entire segment from the time the request for test is asked till the time the physician gets the result to base his diagnosis and start the management. So this entire process happens in the realm of either the laboratory medicine or the imaging or any of the ancillary states. Now, when I look at quality as absence of errors, I'm going to look at each and every segment of that activity to see if there are errors. Because the moment there is an error, the person, the consumer, looks at it as lack of quality. But if everything goes as per plan, he plans his day because he wants to go to a lab, get his test done, get the result, and see a physician. Now if he goes to the lab and the lab says, I'm sorry, we don't have reagents, please come tomorrow. Just imagine the amount of effort that the consumer has put in for that day, and his entire day goes waste. So how do we start to look at quality in terms of errors rather than what quality is? Quality is defined in many ways. Quality is defined as the needs of the consumer. Now for me that becomes very difficult because I cannot measure the needs of the consumer. A simple example I give in just last week, I had a lady who was walking in front of me in the lab, and I was walking behind her, and she looked at me and said, is there an administrator around here? I said, okay, please tell me, I'm here, I can help you, please let me know. So she said, I think your lab hygiene is pretty bad. I was taken aback because we put in efforts on a daily basis to keep the lab clean, and I was taken aback. I said, madam, can you help me? Because we are trying to do our best. So she said, your dustbins or paint boxes. How can you keep paint boxes as your dustbin, and how can I expect a good result from your lab? You see, this perception caught me unawares, because our view was we were trying to recycle and reuse, not paint boxes. For her it appeared to be paint boxes, but we wanted to recycle plastic that gets hugely consumed in the lab and converted nice, decent plastic containers as dustbins. We didn't want to throw it in the waste because that would convert to plastic waste and actually harm the planet. So our perception was we are trying to do something good to the planet, but the consumer's perception was there's no hygiene. So you see how the perception also can add as a variable to the entire situation. So when we look at quality, the number of errors that happen in a laboratory, because I'm limiting myself to the laboratory segment, 70% of errors that happen within the laboratory segment is in the pre-analytical phase. And that is from the time the doctor requests a particular test to the time the test is done on the machine. The next phase is from the time it is done on the machine till the result is obtained. And finally, from the result to the patient getting the report and being seen by the physician. All of these areas is where we are trying to see if errors can be minimized. Believe me when I tell you this, there is no lab in the world without errors. Question then is, how much effort is each of these labs putting in to minimize errors? Oftentimes, as humans, we are fearful of errors. Because we fear errors so much, we don't even identify them. It is happening right in front of us, but we don't identify them because the human mind is fearful of errors. So it's not identified. If it is not identified, it is not analyzed. If it is not analyzed, we do not know why it is happening. And if we do not know why it is happening, we cannot find a fix. If we cannot find a fix, on a daily basis, the errors start going up. When the errors start going up, the perception of quality starts going down. So it is very clear that we have to track down errors because the perception of quality then starts to go up. So in the overall scheme of things, it is very easy to claim that we have good quality. But my question then would be, how many errors happened in the last month? The moment I know that, then I know that the perception of quality is going to change. So it is an effort, it is something to do with the human mind. So if all of us are collectively trying to look at this in terms of quality, I think we need to look at it from the point of view of errors. And that's something that is extremely uncomfortable for the human mind, because as we grow, as children, the moment you're